Good afternoon, friends. So let's begin with the MCQs. And first one is it's a person who comes to the emergency department with suspected poisoning due to ingestion of arsenic-containing pesticides 6 hours ago. So which of the following would you not expect to find? So I will repeat the question. The question is basically it's a case of an arsenic poisoning, and in this case the patient comes to you with the arsenic poisoning within 6 hours. And which of the following would you not expect to find in a case of arsenic poisoning? Options are measles line on nails, second is cholera like gastroenteritis, third one is garlic odor of the breath, and the fourth is it's an acute tubular necrosis. So I repeat, it's an emergency case. We have a patient with arsenic poisoning that to 6 hours ago only. So it's a case of acute condition. So which of the following would you not expect? Measles line on nails, cholera like gastroenteritis, it's a garlic odor of breath, or it's an acute tubular necrosis. So if you want to tell the answer here, the answer is it's A, that is measles lines on nails. So measles lines on nails is not seen acute arsenic poisoning. Basically it's a chronic. If it's a chronic case, then only you can find a measles lines that is on nails. And others like cholera like gastroenteritis, you can see that. Garlic odor you can see, acute tubular necrosis also you can see that. Okay, I'll tell you what are the features here of arsenic poisoning that is acute. We have, I told diarrhea, it will be cardiac arrhythmias, acute encephalopathy, renal injury, and garlic odor, what I told already. So if there is a measles line, it will be around 4 to 6 weeks after acute ingestion poisoning, acute arsenic poisoning. So next we move on. It's next question we have is which of the following is false about the surgical repair of vesicovaginal fistula? So it's a case of a vesicovaginal fistula here, and they are asking what is false in this. And the options are: first, LATJO, that is a LATJO procedure produces good result. Second is it's after following a failed attempt. A second attempt can be made only after 4 weeks. And third is continuous bladder drainage required for 14 days post-operatively. And the fourth one is fistula at the vaginal vault is the most difficult to repair. So I will just repeat, it's a case of that is vesicovaginal fistula. We are doing a surgery, and after the surgery, which of the following is false? The options were LATJO procedure produces good results. Second one was following a failed attempt. Second attempt can be made only after 4 weeks. And third was continuous bladder drainage is required for 14 days post-operatively. And the fourth one was fistula as the vaginal vault is the most difficult to repair here. So if you can answer this, which of the following is false? So which of the following is false, you can answer here. Okay, I will tell it's B. That is B option is following a failed attempt. That is, we are doing a vesicovaginal fistula surgery. So following a failed attempt, second attempt can be made after 4 weeks. No, it's wrong. You can only do it after 3 months. We can do only after 3 months. So others like what are the surgery for vesicovaginal fistula? We have LATJO procedure, which I told. We have Chesson-Moyle technique, and the last one is ureteric implantation. So LATJO procedure produces good results, and continuous bladder drainage is required for 14 days. It's right, and it is difficult to repair. That is a fistula at the vaginal vault is difficult to repair here. So it's too much sunlight here, I think. Okay. Next question we have, it's a case of a 21-year-old woman who presents to you with increasing fatigue and numbness and tingling in the leg. So in high school, she started a vegan diet in order to reduce some weight. So on examination, glossitis is seen and hyperreflexia is present in the lower limb. Lab investigation we have done. Lab investigation shows that HB is 5, TLC is 6000, platelet is 1 lakh, and MCV is 109 femtoliter, and vitamin B12 is 90 pg per ml. So which of the following findings is not seen in this condition? So basically you can just diagnose in the case, otherwise only you can tell. I'll just repeat, it's a 21-year-old patient. There is numbness and tingling, increasing fatigue. When he was in a high school, he started a vegan diet, and in order to reduce some weight, examination you have glossitis, hyperreflexia in the lower limbs. Then we have lab investigation, which I told, HB 5, TLC 6000, platelet 1 lakh, MCV 109, vitamin B12 is 90. So which of the following findings is not seen in this condition? So you can tell what your diagnosis is first. Without knowing a diagnosis, you won't be able to tell. See, B12 only you can tell. From B12 only, it's a B12 is 90 pg per ml. So yeah, if you have a B12 that is 90 is very low, so it's a case of B12 deficiency. It is a case, and in B12 deficiency, basically the question here is which of the following finding is not seen in this condition, and the options were decreased homocysteine levels, positive Romberg sign, optic atrophy, and dementia. Anyone wants to answer this? It's a case of B12 deficiency. Okay, I will only tell today, no one is there. So yeah, it's basically A is the right answer. Decreased homocysteine level is the right answer. See, normally in B12 deficiency we don't see a decrease, it will be opposite. So in B12 deficiency we see a increased homocysteine levels, and yeah, so positive Romberg sign you will see in this condition. In late stage you will see optic nephropathy and dementia also we will see here. So yeah, so it was a case of vitamin B12 deficiency. Next we move on. Next question we have, it's which of the following cartilages form a complete ring? It's a thyroid, cricoid, cuneiform, or epiglottis. It's an easy question. I will just repeat. Which of the following cartilages forms a complete ring? It's a thyroid cartilage, cricoid cartilage, cuneiform, or epiglottis. Anyone? It's an easy one, but yeah, we should know. Okay, the answer here is it's a cricoid cartilage. So cricoid cartilage is the only cartilage which will form a ring. That is, it will form a complete ring. So yeah, the answer is cricoid cartilage here. So next we move on. At what age would a child attain full visual acuity? And the options are 6 months, 1 year, 3 years, and 6 years. I will repeat. At what age would a child attain full visual acuity? Options are 6 months, 1 year, 3 years, and 6 years. Anyone wants to answer this? Okay. Okay, the answer is 6 years. So at 6 years, basically a child will attain a full visual acuity. So I will just tell you the milestones here. The milestones are basically it's at birth. There is no central fixation and the eyes move randomly at birth. And then we have at the first month we see fixation reflex starts developing, and it is established by the 6 months. And then by 3 months we see a binocular vision, and then by 6 months macular stereopsis and accommodation reflex is seen. And the question what was there, it was 6 years, that is full visual acuity will be attained by 6 years. So yeah, next question we'll move on. It's a 64-year-old male patient who is admitted with complaints of weakness of the extremities and blurry vision and nosebleed. So on examination there is lymphadenopathy and dilatation of retinal veins. So peripheral smear is shown below. Which of the following is false regarding this condition? So yeah, I will just tell you what is the pathological picture here. So it's a pathological picture. It's basically, I cannot tell. Okay, I will just tell the question once again. The question is, it's a 64-year-old male patient who comes to you with the complaints of weakness of the extremities, blurry vision, and nosebleed. On examination, there is a lymphadenopathy and dilatation of retinal veins. So peripheral smear is given below. Which of the following is false regarding this condition? So yeah, if you can tell. And in the image they are given, it's a Rolex formation. So yeah, you know when do you have a Rolex formation? Okay, I will only tell it. Okay, I will move on. So yeah, it's a case of, anyone know what is a case? Okay, it's a case of Waldenstrom macroglobulinemia. I also don't know this. Yeah, it's a case of Waldenstrom macroglobulinemia, and we see all this. That is, we find a Rolex formation in pathological picture. We find a weakness of extremities, blurry vision, and nosebleed. We will also get lymphadenopathy and dilatation of retinal veins. So yeah, so the option right answer is lytic bone lesions is the right answer here. See, bone marrow greater than 10% lymphadenopathy cell is the false. So lytic bone is a false basically. Yeah. Lytic bone lesion is a false. Basically, it does not cause lytic bone lesion. The answer here is M component of serum that is greater than 30 gram per liter is right. Increased viscosity of the blood is also right. Bone marrow greater than 10% lymphoplasmocyte cells is also right answer here. So yeah, we will move on. We will move on to the next question. The question is, a 61-year-old man comes to you with the complaints of fatigue and shortness of breath. So he has conjunctival pallor and has lost significant weight over 3 months. CBC reveals low hemoglobin and MCV. stool occult blood test is positive. So what is the next best step in the evaluation? So you have to tell what is basically you have to tell what is your diagnosis here. Then only you can tell. I'll just repeat. It's a case of a 61-year-old man who comes to you with the complaints of fatigue and shortness of breath. So it's a fatigue and shortness of breath. He has conjunctival pallor and has lost significant weight over 3 months. CBC shows there is a low hemoglobin and MCV. A blood occult test is positive. What is the best next step in the evaluation? Anyone wants to answer? Okay, the answer here is best step it will be options were barium enema, colonoscopy, MRI, CT scan. So yeah, the answer is colonoscopy. Why? Basically, it's an elderly patient here and with sudden onset of anemia, which is given below because CBC has a low hemoglobin. So there is a sudden onset anemia which warrants screening for colorectal cancer. So yeah. So as cancer in the right colon often manifests as melena as they have given here, and fatigue associated with anemia. So yeah, it's a case of a carcinoma. So in case of a carcinoma, we will generally do a colonoscopy. So yeah, the answer is best step in evaluation is colonoscopy in this case if you have a low hemoglobin and which is associated with anemia. And that too, if it is the right colon, you will suspect a carcinoma in this case. So next we have it's a patient who was diagnosed with meningitis is on chloramphenicol therapy. So which of the following blood dyscrasias has a side effect of this drug? So I will tell the side effect in this condition. I'll just repeat. It's a patient who was diagnosed with meningitis and is on chloramphenicol therapy. So which of the following blood dyscrasias has a side effect of a drug? It's hypoplastic anemia, agranulocytosis, aplastic anemia, or it's thrombocytopenia. So yeah, you can tell. So yeah, we are talking about chloramphenicol here, and chloramphenicol will cause the following blood dyscrasia, and it will be basically it's a aplastic anemia. Which of the following has a side effect of this drug? It's aplastic anemia. So C is the right answer. So yeah. So the patient is most likely to have a aplastic anemia. It is common blood dyscrasia associated with chloramphenicol, and it can lead to fetal pancytopenia that has high rate of mortality. So yeah, we'll move on to the next question. The question we have is it's a multigravida patient who is posted for LSCS and due to the arrest of descent of labor. So it is defined as no descent for options are greater than 0.5 hour, 1 hour, greater than 1.5 hour, or it's greater than 2 hour. So yeah, I will just repeat. It's a multigravida who is posted for C-section due to the am I audible or it's just I am speaking. So yeah, I'll just tell it's a multigravida who is posted for LSCS due to arrest of descent of labor. So it is defined as no descent for it's a 0.5 hour, 1 hour, 1.5 hour, or 2 hour. So yeah, I will only tell as no one is there now. So yeah, the answer is greater than 1 hour. So if there is a descent that is greater than 1 hour, so we will tell it is a multigravida is posted for C-section, can be posted for C-section due to arrest of descent in labor. So yeah, it is defined as no descent for greater than 1 hour. So yeah, we'll move on to the next question. And the question here is basically it's a young adult and was injured in a steam boiler explosion at his factory. So he was rushed to the burn center with multiple injuries covering 40% of the total body surface area. So he weighs around 70 kg. The volume of fluids to be administered in the first hour is basically you have to tell it's the formula, Partland formula only you have to use here. And in Partland formula, you know, usually it's a 2 ml per kg into percentage of TBSA over 24 hours. So yeah, it's basically half the volume over the first 8 hours, that is 1 ml per kg into TBSA, that is lateral solution will give here. So yeah, the answer will be 3 liters. Approximately in a 70 kg person, 40% of total surface area they have given. So it's 1 into 70 into 40, that is around 3 liters we have to give. So yeah, next we move on. It's who among the following patients is likely to have the best prognosis? I repeat, who among the following patient is likely to have the best prognosis? And the options are a patient with mononuclear variant of, that is RS, red skin blood cells on lymph node biopsy, a patient whose lymph node biopsy showed lacunar RS cells, or it's a patient with predominant reticular variant of RS cells, or it's a case of a patient of RS cell amid maturity of background cells. Basically, they are asking which of the following is we have a patient with best prognosis. So we are talking about that is lymphadenopathy, that we are talking about RS cells, that is Hodgkin's lymphoma we are talking about. So yeah, it's a big question. I will just give the answer here, but I will just repeat and you won't be knowing this. So yeah, it's the patient who have a best prognosis is a patient whose lymph node biopsy showed lacunar RS cells. So yeah, it's RS cells are seen in this lacunar RS cells are seen in this condition, and it's a prognosis of the nodular sclerosis subtype of classical Hodgkin lymphoma. It's better than other lymphoma. So to remember, it's a case of nodular lymphoma. It's a case of nodular sclerosis in Hodgkin's lymphoma, and in that case, it has a best prognosis that you have to remember. So yeah, I just told nodular sclerosis subtype of classical Hodgkin lymphoma is better than other types. So we move on to the next question. The question we have is which of the following is not considered as a myeloma defining event according to the revised criteria for a diagnosis of multiple myeloma. So yeah, we are discussing about multiple myeloma here, and the question is which of the following is not considered as a myeloma defining event according to the revised criteria. So the options were more than one focal lesion MRI of 5 mm or more. Then we have 60% or more monoclonal plasma cells on bone marrow examination, and then we have a biopsy proven plasmacytoma, and then we have just serum involved or uninvolved free light chain ratio of 100 or greater. So yeah, basically I am discussing a case of a multiple myeloma. So yeah, we have to tell which is not considered a myeloma defining event. So yeah, it's a very long question. So yeah, I'll just tell the answer here. It's not considered is a biopsy proven plasmacytoma. We don't do here. So in case of a multiple myeloma, we don't do a plasma proven pancytoma. So other options what I told, yeah, we do all that. That is more than one focal lesion we have. That is in the MRI we do. Then we have a plasma cell that is 60% or more that we can do. And then it was serum involved or uninvolved free light chain, what we see in multiple myeloma. Yes. Then we move on to the next question. The question is, it's a 30-year-old thin-built man presents to you with urethritis. So it's a case of urethritis, and you do a gram scanning. It shows purulent discharge. And what is the treatment of choice for this infection? I'll just tell you the pathological image here, and the image is basically it's a Neisseria gonorrhea, because we are seeing a intracellular diplococci. So when you see a intracellular diplococci that is gram negative, it's a case of Neisseria gonorrhea. And what we give? We give ceftriaxone 500 mg IM plus azithromycin 1 gram PO stat. So yeah, the answer here is in a case of Neisseria gonorrhea we give ceftriaxone 500 mg IM plus azithromycin 1 gram PO stat. So yeah, that's the question was there. So we will move on. It's we have a 45-year-old male patient who presents with the chortle swelling, underwent an orchidectomy. So the image below shows the histopathological findings. What is your diagnosis? So yeah, it's a 45-year-old patient who presents with chortle swelling, underwent orchidectomy. The image below shows the histopathological image. So what is your diagnosis? So okay, it's a specimen of seminoma. The answer I told, yeah, it's a seminoma. So yeah, and they have given a gross specimen that is a grey-white fleshy homogeneous mass is seen. So if you see a grey-white fleshy homogeneous mass with loculated cut surface, usually devoid of hemorrhoids or necrosis, it's a case of seminoma. So yeah, it's seminoma. See, if there is a yolk sac tumor, it will be yellowish white mucinous appearance, and if it's a embryonal cell carcinoma, it is variegated with foci of hemorrhage or necrosis. And option D, that is teratoma, it would have a variegated appearance, but this is reflecting the multiplicity of tissue types. So yeah, the best appearance what they have given, the microscopic appearance is of seminoma in this condition. It's a grey-white fleshy homogeneous with lobulated cut surface. So yeah. Next we have you have started an infusion of drug Y in a patient at the rate of 200 mg per hour, and drug Y has VD of 100 liters and clearance of 100 ml per minute. So what will be the drug concentration at the steady rate? So yeah, no, it's a case of it's a formula here. So yeah, the formula is basically it's a case of concentration, and concentration formula it's a rate by clearance. So in this condition they have given the rate is 100 into 60, that is 6000 ml is in this case they have given. So yeah, overall they are asking the clearance, that is the concentration they are asking. So yeah, in this the drug concentration, the answer will come to 33.33 mg per dl. So yeah, because steady state concentration is 33.33 and it's a rate of infusion by clearance. Rate of infusion they have given 200 and VD they have given 100 liter. So yeah, it's 100 into 60. Really 33.33 is the right answer. Then we move on. It's a 9-month-old baby. So yeah, it's a 9-month-old baby with diarrhea, is feeding well and is thirsty. Skin pinch when done returns to 4 seconds. So what is the treatment? So yeah, I will repeat the question. The question is, basically it's a pediatric question, and the question is, it's a 9-month-old baby with diarrhea, is feeding well and he is very thirsty. So skin pinch when you do, it does not return in 4 seconds. Where skin pinch when done returns in 4 seconds. So what is the treatment here? Options were 200 to 400 ml of ORS you can give in the first 4 hours, or it's like 400 to 700 ml of ORS you can give in the first 4 hours, or third option 700 to 9 ml, that's same only for first 4 hours, or in addition to the usual fluid intake 100 to 200 ml should be given after the loose stools. So yeah, it's a skin pinch when done returns in 4 seconds. So yeah, it's a case of some dehydration and comes in the plan B, and that is the amount of ORS given in 75 ml per kg body weight, hence 400 to 700 ml can be given in this case. Yeah, I know I am going very fast, but yeah, it's okay. You have to see there is a chart for that, some dehydration and all that. Severe dehydration, some dehydration, no dehydration. So as per the some dehydration, you know, the skin pinch will fall back in 4 seconds. So it's a case of some dehydration and it's 400 to 700 ml ORS you have to give in the first 4 hours. So yeah, let's we move on. It's a poultry worker was admitted to ICU with severe pneumonia. I repeat, it's a poultry worker who was admitted to ICU with severe pneumonia. Bronchoalveolar lavage was done. It shows leventical coli lily bodies. So I repeat, it shows leventical coli lily bodies. So which of the following is the quality organism for this condition? Legionella pneumophilia, Chlamydia psittaceae, Microplasma pneumonia, or it's a Molecular catarrhalis. Anyone wants to answer this? It's a poultry worker admitted to ICU with severe pneumonia and bronchoalveolar lavage was done. It shows leventical coli lily bodies. Which are the following quality organism? So yeah, the answer is Chlamydia psittaceae. It's a very specific for that is leventical coli lily bodies, is very specific in case of this condition. The condition is psittacosis, and in psittacosis we have the quality organism, that is Chlamydia psittaceae. Next we have, it's a PSM question, it's an easy one. Which of the following statement is false about the Ayushman Bharat National Health Protection Mission? Options are: government provide health insurance up to 5 lakh per family per year. The limit of the family size that is covered is up to 7 members. Or we have all pre-existing disease of the individual are covered, and we can also have it cover secondary and tertiary care hospitalization. So yeah, it is false. So its false statement here is a B, that is the false statement that the Ayushman Bharat National Health Program Protection Mission is not basically for 7 members. So yeah, that is the right answer here. The limit of the family size that is covered up to 7 members in the, basically it's a false answer here. And there is no basically cap that you can have any number of members in your family. So yeah, let's move on. It's a case of Austin's classification for anatomical defects in the ossicular chain is based on which of the following structures? So I repeat, it's an Austin classification for the anatomical defects in the ossicular chain is based on which of the following structures, and the options here are malleus head and that is a stapes suprastructure, B is malleus head and stapes footplate, C is malleus handle and stapes footplate, and the last option is malleus handle and stapes suprastructure. So yeah, if you can answer this, it's the Austin classification. If you know, then only you can answer this. It's an Austin classification for that is the anatomical defects in ossicular chain is based on what? So yeah, okay, the answer here I want to tell, it's malleus handle and stapes suprastructure. It is based on that. It's a handle of malleus and stapes suprastructure. So next we move on. The next question we have, it's which of the following sensory receptors are responsible for tactile discrimination? I repeat, which of the following sensory receptors are basically responsible for tactile discrimination? And the options here are marker disc, affini end organ, Pacinian corpuscle, or it's a mesenal corpuscles. So yeah, which of the following sensory receptors are responsible for tactile dissemination? So what I know is, yeah, I am right. It's a mesenal corpuscles in the skin. We have discussed it yesterday only. It's the mesenal corpuscles which is responsible for tactile dissemination. And yeah, next question we will move on. It's a woman who comes to you with constant fear of sinning. She was unable to look at people for fear that she was offending them by inappropriately glancing them. So yeah, I'll just tell. It's a woman who is presented with the constant fear of sinning. She was unable to look at people for fear that she was offending them by inappropriately glancing. Yeah, okay. I'll just repeat the question. It's a woman presented with the constant fear of sinning. She was unable to look at people for fear that she was offending them by inappropriately glancing. When people crossed the legs in front of her, she thought that it was because she had been looking at her genitals. So she was constantly prayed for forgiveness for not being devoid of what, I don't know. The question is only useless. So yeah, I'll just tell what is the question here. It's a case of a cognitive behavioral therapy. So in this case, it's an obsessive compulsive disorder, and the patient tells that he has basically sinning. So yeah, it's a psychiatric question. So I'll go to the next question. It's a mother brings a 3-year-old boy with complaints that her urine smells like that of a tomcat's urine. So I repeat, it's a mother who brings her 3-year-old boy complaining that urine smells like a tomcat urine. She also gives history of generalized seizures and perioral desquamating lesions. On examination, the child has global developmental delay and diffuse thinning of the scalp. So if the questions is useless, then why are you discussing? Because they have given it. I have no choice. Okay, I'll just move on to this. Investigation reveal multiple carboxylase deficiency. What is the treatment of choice? Thiamine, pyridoxine, biotin, and methylcobalamin. So yeah, I repeat, it's a mother who brings a 3-year-old boy and she complains that her child has having tomcat's urine. She also gives history of generalized seizures and perioral desquamating lesions. On examination, the child has global developmental delay and diffuse thinning of the scalp. Investigation reveals multiple carboxylase deficiency. What is the treatment of this? So yeah, anyone wants to answer this? Just tell me what is the case. What is the diagnosis here? Okay, the diagnosis is multiple carboxylase deficiency. Now if anyone can tell what is the treatment of choice for multiple carboxylase deficiency? Options were thiamine, pyridoxine, biotin, and methylcobalamin. Anyone? There is a drug of choice for multiple carboxylase deficiency. So yeah. Okay, the answer here is B. Biotin is the drug of choice for multiple carboxylase deficiency, and you see all this whatever clinical features I told you. Yeah. Okay, I'll just tell the last question one again if you want to hear that question. It's a useless question, but I will tell. Yeah. Okay. The question was repeat that question. A woman presented with the constant fear of sinning. She was unable to look at people for fear that she was offending them by inappropriately glancing. So when people crossed their legs in front of her, she thought it was because she had been looking at their genitals. She constantly prayed for forgiveness for not being devout or oral or moral enough. So what is treatment of choice for this disorder? Options were psychoanalytic psychotherapy, cognitive behavioral therapy, SSRI, or it's an electroconvulsive therapy. Anyone wants to answer this? It was a useless what I told, but it's a question. Yeah, I'll just do it. A psychoanalytic psychotherapy, B is cognitive behavioral therapy, SSRI, or it's an electroconvulsive therapy. So yeah. Okay, I'll just tell. Basically it's a OCD. It was a OCD, that is obsessive compulsive disorder, and the treatment what we give is cognitive behavioral therapy. So yeah. Next question, what I told is next question we have, which of the following statement is false about the condition shown in the image below? So yeah, it's the image below which has a contracture, I think. Yeah, it has a contracture. It's a case of ductorian contracture. So yeah, just tell me which of the statement is false regarding the ductorian contracture. And the options are: X-ray is useful in the diagnosis of the condition. it is more common in males. Then trauma of chronic repetitive nature is a common cause. And the last one is surgery is the best treatment. So yeah, which of the following is false about the given image? Anyone? X-ray useful in diagnosis of this condition. It is more common in males. Trauma of chronic repetitive nature is a common cause, and surgery is the best treatment. Answer. I don't want. Okay, I'll just tell the false. False is A, that is X-ray is useful in diagnosis and condition. See, in deuterine and contracture we don't use X-ray because it's on clinical feature only you can just tell. So yeah, and it's more common in males. Trauma of chronic repetitive nature is common in this condition, and yes, surgery is the best treatment. And in deuterine and contracture, what we have? We basically have proliferative fibroplasia of subcutaneous palmar tissue forming nodules. It results in finger contracture, thinning of subcutaneous fat, pitting of skin and knuckle pads. More common in male, what I told already, and surgery is the choice for that. What you don't want. Okay, next we have, it's a patient with prostate cancer is undergoing brachytherapy with iridium 192. So what is the half-life? I repeat, it's a patient with prostate cancer is undergoing brachytherapy with iridium 192. What is the half-life? 5.2 years, 8 days, 73.83 days, 28 years. Anyone? 5.2, 8 days, 73.83 and 28 days. So yeah. Okay, the answer here is C, that is 73.83 days is the half-life. That is, we are talking about here iridium 192. That is, when we give a brachytherapy with iridium 192, the half-life is 73.83 days. Next we move on. Which of the following biomarkers is preferred for diagnosing reinfarction in a patient post NSTEMI? So yeah, it's a case of NSTEMI, and you have to tell which of the following biomarkers is preferred for diagnosing reinfarction in patient with NSTEMI. Troponins, myoglobin, LDH, CKMB. And here is the last question. Troponins, myoglobin, LDH, CKMB. So yeah. So it's the last question. I just was talking about which of the following biomarkers is preferred for diagnosing reinfarction in a patient with post NSTEMI, and the options were troponins, myoglobin, LDH or CKMB. So yeah, you have to really diagnose reinfarction in this condition. So if you can tell. So okay, I will tell, it's the last question. I think no one wants to answer. It's a troponin. You have to remember it. Troponin is the choice for this, and yeah, it's a preferred biomarker for diagnosing reinfarction in this condition. So yeah, so we are very late today. It's already over. So yeah, thank you so much for coming, and yeah, take care.